and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, I have with me as my guest, Sydney Braselton. She is a speech-language pathologist at Sports Plus Henry County. Welcome to the show, Sydney.
Hey, thanks.
Thanks for being here and coming all the way down from Henry County, because we're in Jackson, so that's a good little drive for you.
Yeah.
But welcome to Jackson. Welcome to the podcast studio. So we're wanting to talk about, what a speech therapist does and the speech language program and the Sports Plus kind of Henry County, what all that offers. So what I want to do is start off by just asking you to tell us a little bit about yourself and, kind of what led you to become a speech language pathologist. That's a mouthful.
Yeah, it is a mouthful. I'm kind of familiar with Jackson. I'm from Lexington.
Okay.
So I grew up in Lexington. I did my bachelor's at UT Martin, and then I went to Searcy, Arkansas, and I got my master's in communication sciences and disorders, where I now become a speech language pathologist.
Yeah. It's always interesting to hear how people arrive at their destination
Yes.
goal that they're in.
But yeah, so then after graduate school, I got married. I now live in Dover.
Okay.
Yes, and I live there with my husband, my daughter, and we live on a farm. My husband's a farmer,
Yay.
so that's something that we are always into. We're always doing something with the farm.
Right.
But when we're not doing farm stuff and it's summer, we're usually on the lake. As far as what made me to be a speech therapist, when I was in high school, I was kind of I don't know what I want to do with my life.
Same,
and
yeah.
my parents were very stern that I had to have a plan before I went to college.
So did my dad.
It was no, you cannot just go to college and figure it out. You need to know now. And so I was really stressing about that. But I went to this place with my church, and it's like a community for individuals with special needs, particularly adults. And I was like, man, I want to work here. And so I started researching different occupations and that could work with that population. And speech therapy just kind of hit the nail on the head.
Right.
It seemed like something that was meaningful, I would enjoy, and something that I wouldn't dread
And
doing.
I would assume that every day is different. It's not the same.
Yes.
It's just not the same thing every day, day in and day out. So now it's Sports Plus Henry County now. How long have you been there? And tell us, kind of what it used to be before it became Sports Plus.
Yeah, so I've been there for 2 years. And before it was Sports Plus Henry County, it was the Wellness Center.
Okay.
So same people.
Same location, same people. Yeah, so it's the 1015 Kelly Drive in Paris, Tennessee is still the location. So it has not moved, just the name changed to Sports Plus.
Yes.
So what drew you to work in a community like Henry County?
Well, after I finished graduate school and I moved to Dover, I actually started my career in Clarksville. And that was a different pace than Paris. Clarksville is a big city. And, actually, I did one of my clinical rotations when I was in graduate school at the Plumley Rehabilitation Center, which was in the nursing home, which used to be part of Henry County Hospital. But a lot of the same people overlapped.
Okay, yeah.
They worked in the same building that I'm in now. And when I was there, I got this hometown vibe, and it was very patient centered. The care was patient centered.
Yeah.
It was really great. And I did not that Clarksville's bad or anything, but it was fast paced, and it was a different feeling than being in a smaller community.
Right, yeah, because I know a lot with Henry County, it's a lot smaller, and just having, just some people like a more hometown feel. Yeah, it's it's just your preference. Do you want a more hometown feel, or do you want a more bustling city life?
Yes.
So now about speech therapy, a lot of folks may not know all that speech therapy covers. So explain a little bit about what speech language pathologists do.
Yeah, so in short, we evaluate and treat from the brain to the lungs.
Okay.
That seems a little crazy, but in the speech therapy world, we kind of talk about it as the big 9. So I'll kind of go through those. The first one is articulation. That is how someone is producing certain speech sounds. So, for example, when a little kid might say "whittle wascals" little rascals. But I also see adults, too, for articulation. So not just children, but any type of difficulties with producing certain speech sounds.
Yeah.
The second one is fluency. That's the flow of how someone speaks. So, for example, I might see someone that has a stutter, things like that. Voice and resonance, that's the third one. That's the quality of someone's voice. So, for example, if you have like a vocal nodule or you've had a stroke and it left you with like an abnormal sound with your speech, we work with those people. The fourth one is hearing. I don't fix hearing. That's an audiologist, but I work with people that have hearing impairments which affect their speech.
Right, yeah.
So, for example, I've seen people with cochlear implants, and we worked on
what's different now. That
yes,
because it's a whole new ballgame once you get the implant.
Yes,
yeah.
Absolutely. And like learning different, it's just different. It's learning the speech sound is different once you have that, because it's not just like normal.
Yeah, and I would assume that there's like some muscle memory things in there, and then just repetition to kind of change, whatever. Yeah,
absolutely. Okay, so then the fifth one is swallowing. We see that one a lot, actually. So people who have difficulties with swallowing, specifically in the oral and pharyngeal cavities. So that is the upper part. So your mouth and your throat. We can do something where we can see the esophageal part, but that's pretty much for GI doctors. The sixth part is cognitive aspects. So that's for any difficulties with attention, memory, sequencing, problem solving, or other executive functions. So that could be someone that has dementia or someone following a brain injury. They might have problems with those things. Yeah. Two more social aspects. So that's how we use language. That could include like body language, how to use certain gestures when you're having conversation with people. I often see I work with kids that are on the spectrum with that aspect. And then the last one, which is my favorite, it's AAC. It's augmentative and alternative communication. This just refers to the different ways that people communicate. So that could include sign language, writing, assistive technology, or speech generating devices. Right, so that's a big lot. That's not short at all, but that's all the things that we work on. That
is a super comprehensive list. And when you think of a speech language pathologist, you think, just helping people, with a stutter or, after you've had a stroke or with, verbal, like the way words come out. So you're not even thinking about like the entire exhaustive list. So that's good to hear that it's much more than just that small amount of things.
Yeah.
So who would typically benefit from speech therapy? I know in that list, you did mention, kids, adults, or both.
Yeah, so all of the above.
All the above, yeah.
Yeah.
Just depending on, and like, what are the most common issues or conditions that you help patients with? I know you mentioned some, but are some of them, much more prevalent maybe?
Yeah, so in kids, I typically see like just a normal speech or language delay. So maybe like a kid is having trouble with their L's or their R's. Yeah. That's typically what I see in kids. In adults, I typically see like swallowing issues or memory issues following like a stroke or a brain injury.
Yeah. Now, a coworker of mine's daughter had to have surgery for a tongue tie.
Yeah.
And so that was like 3 or 4 years ago. And at my age, that was the first time I'd ever heard of a tongue tie.
Oh,
so
yeah.
Is that something that you work with? I mean, I guess if you had a tongue tie and you had surgery on it to like affect and relearn how to.
Absolutely. That is so often. In fact, sometimes I see kids that have speech problems and they had a tongue tie that was never caught.
Right, yeah.
And so, I mean, it'd be better if they could get it cut when they're babies because it's less traumatic, and then they don't
remember it.
Yeah, they don't have to relearn their words and things like that.
Right,
But sometimes, I mean, not all of them affect speech, but some of them do. But yeah, that's definitely very common in our field.
Yeah. And I mean, like, I'd never heard of that. And I was like, how many people have that and don't know it? That's just crazy.
I actually have a tongue tie and a lip tie that was never cut.
And you're just living with it?
I'm just living life.
I was saying, you wouldn't know.
Yeah.
For me. So with your role as a speech therapist, how does that fit with the rehab services at Sports Plus? Because typically when people think of that, they think of physical therapy, not necessarily speech therapy.
Yes. So we cover, me and Suzanne, my colleague, we cover inpatient, outpatient,
Okay.
occasional home health, and then a school system contract.
Oh, so just a whole, you're all well-rounded there.
Yes, I think I see like every type of person you could possibly see. We do all the things that we just talked about. I can assess and treat anyone who basically has a problem with eating, swallowing, or thinking.
Right, yeah.
So that's typically what we see in a day at Sports Plus Henry County. I'll do a lot of kid patient treatments and a few adult treatments. And then we do the inpatient services. So if you're at the hospital, we go up there and check you out, make sure you're doing okay. Yeah. We occasionally do what's called an MBS, a modified barium swallow study. That helps us see. It's under radiation, so we can physically see the swallow and see if you're safely swallowing food.
Gotcha, yeah. Oh, yeah. That makes sense.
Yes.
Like, that's an important part of life.
Yes.
So, and you mentioned this in one of your, one of the lists that you gave. So often working with patients recovering from strokes, concussions, or other neurological issues, how do you work with those other, like, you mentioned gastro, neurology. What's it like, working in tandem with those professions as well? Yeah,
so it's pretty fluent, I guess. We, a lot of times we'll see a patient and I'll say, I don't think you necessarily need this. You might need GI.
Yeah, I was going to say, sometimes it's like, does the neurologist send them to you, or do you get a patient and then, like, I guess you're just kind of referring to each other in certain
mixed.
cases. Yeah.
It's definitely mixed. Like, sometimes.
And it's collaborative. Yeah.
Yeah, absolutely. So, actually, I get a lot of patients from the ENT working on voice and pairs. That actually, I see a lot of people with voice, particular people with Parkinson's disease.
Okay. So does speech therapy play a role in helping athletes or patients, get back on the field or return to daily life?
I mean, we can if you have a concussion and you're having some difficulties, particularly with that. I would say we definitely can help those people if they're having a problem with one of those things. We definitely help a lot of people return to their daily lives.
Yeah.
So, if it doesn't matter what age you are, but if you have a stroke and you come in and you don't really remember what you're supposed to do at home to wake up in the morning, how do I brush my teeth? We can help you with that. Yeah. I don't necessarily help you do the brushing. That's more of occupational therapy, but I can help you.
It's all so interconnected.
It is. Everything's interconnected. We all help each other do something. It's a team effort.
Yes. So you mentioned Parkinson's. So what are, are there different types of therapies for that particular disorder, or how to do therapy for that?
Yeah, so actually I'm trained in LSVT Loud, which is the Lee Silverman voice treatment. That is supposed to help patients recalibrate their voice, because oftentimes people with Parkinson's disease get a soft, low voice, and they don't perceive it that way, but it is. And so it's difficult to understand them. So I'm trained in that treatment, and that helps them to be able to speak louder, clearer, and just overall better.
Yeah.
But my colleague Suzanne Jackson, she's trained in Vital Stem, which is a treatment for swallowing disorders. She attaches electrical nodes to you, and it provides stimulation. Okay. So while you're eating and you've got these electrical stimulation stuff going on, it helps you build muscle quicker than just doing it without it.
Which isn't as scary as it sounds.
Yeah, it does seem scary.
I was going to say, I've done physical therapy, and it's just a little bit of a tingle kind of.
Yes. Yeah, so it's not.
So it's don't be thrown off by that.
Yeah, it's not scary, I promise. Yeah. Now, you might look like a mummy when you're in there doing it because she wraps you up and stuff. Yeah. But it's actually very beneficial to a lot of patients.
Great, yeah. And now I always like to ask people this, if you want to share a story without names that shows, how speech therapy made a real difference in someone's life. Because I always in professions like yours, that's some of the best part of the job is.
Yes.
Having a particular story, affecting someone's life.
So it's actually, this question I feel like is so hard because there's so many people that I feel like speech therapy has positively affected. For example, I've had parents tell me, oh my gosh, thank you so much for fixing his R. He sounds so much more intelligible. Like, people don't have to ask me what he's saying when we're in public. And that's so meaningful just to the parents. Or like when I've helped little kids say their first words, like that's so meaningful to the parents. But one particular person that I have in my mind that I wouldn't say that this is the most meaningful story, but it just played the biggest, it pulled the biggest string on my heart. I was working with this little girl, and she had cochlear implants, and I actually had gotten her from another treating therapist that was on maternity leave. So she was actually kind of teaching me. She knew a lot of signs, and she would quiz me. Like, she would show me the picture and be like, what's the sign? And I would have to show it to her, and then we would make sure she was doing it right. And she did really well. But one day we were in the room, and we were going through our cards, and she saw something, and she kept, like, pointing and freaking out. And I was like, what are you looking at? Like, what's going on? And she couldn't tell me. And finally, I saw it. It was a fly. And a fly was like bugging her. And so I looked up the sign real quick because I didn't know as many signs then as I know now. And so I taught it to her. And then another therapist came walking by the room. She pulled them in the room and pointed at that fly and did the sign. And like she understood what she was saying. It was just so sweet to see her like so excited to use like her new learned sign. It was so sweet.
She learned, you learned, the other person, and it's like you're all just communicating with each other. And that was kind of one of the things you said about the augmented with the two A's.
Yes, AAC.
Yeah.
Yeah.
So yeah, I just love that. That is such a sweet story.
It was sweet. It was funny and it was sweet. And it's just something. It's a memory burned in my.
That's in there. Yeah, it's such a positive experience.
Yeah.
So that's kind of leads me to my next question is what do you love most about working in speech therapy and like you said in a small community like Henry County?
Yeah, so my favorite, what I love about working in speech therapy in general is just that it's so embedded into someone's quality of life. I mean, we take it for granted every day, eating, talking, and thinking. Those are all things that we do every day. And then when one of those things doesn't work, it really does
affects
it. Yeah, it's a huge effect on your life.
Right.
And so I love that I'm able to help people get a better quality of life.
Right. Yeah.
I love that. But something that I love about working in Paris is just that, like we were kind of talking about earlier, it's that hometown feel. But like not just the people that you work with, but the community that you're working with, they start to feel like family. And it's almost like when it's time for them to be done with treatment, you're like, oh,
I know,
no, like, please don't go. But like, yay, I'm so excited you're done.
Yeah, it's like bittersweet. Oh, it is bittersweet, yeah. So how can people know if they or their loved one might benefit from a speech therapy evaluation? Yeah,
so in the general terms, if you have trouble with eating, thinking, or talking,
speech therapy might be for you.
Yeah, it would. And it does not matter your age at all.
Okay, yeah. So do you need a referral, or they can, self-referral, call the...
Yeah, so most of the time, patients benefit from a referral. They do.
Yeah, so if you saw your primary care, or if you had an ENT, ear, nose, and throat doctor appointment, or, a gastro or neurological.
Yes. It doesn't
that might
have
be
to
something
be,
if you have that, or go to that person and mention it.
Yeah, it doesn't necessarily have to be your PCP, or your primary care doctor. But if you went to the ENT and they were like, "No, you're good. Like you don't have any problems in there," but you're like, "Something's wrong." Like they could refer you to us still.
You can still advocate for yourself and say, I would like a referral.
Yes.
So and if you wanted to call, I guess if they call the number, they could talk to someone about it.
Yeah.
The number for Sports Plus Henry County is 731-642-2411, and all this will get put in the show notes as well. So do you have anything that maybe people misunderstand about speech therapy that you want to get out there?
I just feel like most of the time people think I just play Candyland
all
day.
I was going to say it's that people have a much smaller understanding of what is an all-encompassing.
Yes.
So I'm glad we were able to get like a lot of the huge big list. It's like people only knew about like 2 or 3 of those things on that list. Would you give any advice to someone who's maybe hesitant to start speech therapy? Like if they're like nervous about it?
I'd say just do it. It can't hurt.
I was going to say, and the person is there to help you, and you know,
it's not like this is.
You don't have to. You're not graded or anything. I guess. Yeah,
you're not graded. It's not going to hurt you. You're just going to come and talk to me. For a little bit.
Yeah, and it's a good time.
Yeah, we have a good time.
Yeah,
we play Candyland sometimes.
No pressure. Yeah. Well, all right, Sydney. Thank you so much for coming on and sharing all about this. And I'll put the information about Sports Plus Henry County in the show notes. And all right, well, Sydney, thank you so much for coming on and talking to us about all the different aspects of speech language pathology. I know a lot of people don't have as broad of an understanding of all that is entailed in that. So thanks for coming on and telling us about that and sharing that. You know, if you're in the Henry County area, come see Sydney. Give us a call at that number and see if you need to be referred if you have any kind of issues. And thanks for coming on.
Yeah, thanks for having me.
Thank you. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.